Firstly, thank you to the organisers for inviting Women with Disabilities Victoria to present today. And also I'd like to acknowledge our board member, Suzanne Legui, who is a positive woman and who's done so much work to see disability recognised in the conference program, and also to organise the fantastic Disability Networking Zone. I need to explain, I'm not going to probably be giving you the eye contact that you deserve. I've got a vision impairment, so I'll be looking quite closely at my notes. Worldwide, we know that women experience high rates of violence and sexual assault. The rates of STIs spread through sexual assault are difficult to measure, but we know that it's a significant risk. After experiencing sexual assault, there are barriers to reporting and seeking support and treatment. UNAIDS reported this month that women and girls with disabilities experience all the risk factors for acquiring HIV, and they're at higher rates of experience higher rates of sexual assault, and they mark this as a significant public health and human rights issue. While Australians live in a peaceful country, experiences of violence are prevalent and severe in the lives of Australian women with disabilities. This is a reality across our lifespans, in our homes and in institutions. This presentation will cover the prevalence of violence against women with disabilities here in Victoria, and also look at practice examples of good practice of strategies for safety. This year our organisation released the Voices Against Violence research findings. This included a review of women with disabilities files at the Office of the Public Advocate. The review found that 45 of 100 women reported experiencing violence, and these women experienced violence at the hands of 89 perpetrators. We found that most commonly perpetrators are intimate partners, but women with disabilities also commonly experience violence from multiple perpetrators, which can be family, co-residents, or even support workers. One woman reported 15 perpetrators through the course of her life, another 37. This review finding was supported by interviews with women and a broad literature review. Women with disabilities in institutions are also not safe from violence. The Victorian Mental Illness Awareness Council found that 45% of women experience sexual assault during a mental health hospital admission, and that 80% or more lived in fear of being abused while in hospital. The numbers found in these reviews are particularly stark when we consider that violence against women is an underreported crime, and that there are many, many barriers for women with disabilities to receive support. We heard these barriers through interviews with women, and I've noted some of them here. Time and time again, we heard that when women reported violence, they weren't believed. And many of these examples are about discrimination, which is also experienced by positive women. Beyond all these barriers, there are even more service barriers for women from additionally marginalised groups: older women, Aboriginal women, and culturally isolated women. Governments and services must be informed of their responsibility to uphold human rights, to safety and justice. So I'd like to share some strategies through 4 practice examples of strategies for safety. The first one's about creating accessible services. Making Rights Reality enhances existing services at a sexual assault centre and a legal centre to create better access for people with communication difficulties and intellectual disabilities. Staff develop skills in working with clients who use communication boards to point at what they need to say. Many of these clients would not find any other service that was accessible to them. And the team developed easy English information sheets about sexual assault, which you can see by accessing their website. The project evaluation found that the service received a surge in disabled clients, and in terms of justice outcomes, it's extremely rare for cases of crimes against women with disabilities to make it to court. But through this service, there are many court cases pending, and one offender has already been found guilty. Hopefully in the near future, we can be sharing good practice examples of working with men who choose to sexually assault women with disabilities. The next example is about the importance of integrated policy. In response to sustained advocacy, the Victorian Government and Police at times consult with women with disabilities when developing policies, plans and guidelines. As a result, key documents include specific strategies for women with disabilities. And thirdly is an example about prevention. The Barwon Centre Against Sexual Assault runs sexual assault prevention programs in schools, realising that systemically kids with disabilities are left out of safe sex and healthy relationships education. They tailored a program for children with disabilities in a special developmental school. They took a whole-of-school approach involving all staff across the school. And the fourth example is about workforce development. Disability service workers usually do not receive any awareness training about violence against women. To address this gap, Women with Disabilities Victoria are delivering a workforce development program on gender and disability. This covers recognising, responding and preventing violence against women. The program is informed by the understanding that people who choose to use violence against women believe in rigid gender stereo roles, male entitlement, and that they target victims who they see as less powerful. The program challenges these attitudes and successfully challenges these behaviours. The really exciting thing about this training is that it is co-facilitated by women with disabilities, so staff learn directly from women's experiences, just as we are today. The Gender Training Initiative will also empower disability service clients through a women's peer education program. So what can we learn from these programs? Well, there are certainly problems and there are solutions, but the solutions being implemented are in isolated programs. We need a commitment from governments and leaders to resource systemic changes. For example, why don't all children with disabilities receive sex education? Why can't all disability service workers receive awareness training? And why can't all relevant policies recognise both gender and disability? The practice examples shared today don't require lots of money. They're about changing attitudes, sectors working together, and most importantly, listening to women. Thank you.